I don't take no for an answer.
Yeah.
If I want something, I'm going to get it. That's the only way I look at it.
I'm Dr. Craig Thomas, and I am a member of the Rankin Orthopedic Group at Providence Hospital in Washington, D.C. I was actually the first person in the United States to use the hybrid plasma scalpel for orthopedics. We didn't have to do any extra training. In terms of use, it's the same as a conventional Bovie. However, the technology makes it a much more powerful tool. The use of the hybrid plasma scalpel has the advantage, in my opinion, of not using a tourniquet without compromising surgical outcome. Those patients that have poor blood supply to the lower extremity, however, still need joint replacement surgery, are at risk for wound healing issues. My transfusion rate used to be 30% prior to using the hybrid plasma scalpel. Now it's below 5%. So that is a benefit to the patient. It's also a benefit to the hospital system in whole, because 1 unit of packed red blood cells is $500. And generally, if we have to transfuse someone, we give them 2 units. So that's about $1,000 per patient that we've saved our hospital by using the hybrid plasma scalpel. Hybrid plasma scalpel has been tremendous in my practice. There have been on a few occasions where we've had to revert back to the conventional Bovie, and what we've noticed is that once you go over a certain area with the conventional Bovie, you have to later revisit that area because there's some bleeders that pop up. What I found with the hybrid plasma scalpel is that it's more definitive in its ability to coagulate, and I don't have to revisit those areas.
What's going on, YouTube? It's your boy, Coach Bear, back again for another Testimony Tuesday. I have a great family friend, Dr. Craig Thomas. He's an orthopedic surgeon. How you doing, Dr. Thomas?
I'm doing fine, Big Cam. How you doing?
I'm doing good. It's good to see you.
Likewise.
Yes, sir. Yes, sir. So you can go ahead and tell the people where you're from.
I'm from Philadelphia, born and raised. Then came down to Howard University for undergrad.
Okay.
And, I was a swimmer. I think you know that. We'll talk about that a little bit. Majored in chemistry. Then I went back to work with Merck Sharp and Dome in Philadelphia as a chemist, making drugs, legal drugs, HIV drugs and drugs for osteoporosis. Then decided instead of getting a PhD, I wanted to get an MD. So I came back down to DC, went to Georgetown for medical school and Howard for residency, and then did my fellowship in Baltimore and stayed down here in Maryland, right where you are.
All right. Well, you from Philly, you gotta be an Eagles fan, huh?
Of course. I mean, you're an Eagles fan for the next 10 or 15 minutes too.
Oh man. So just tell the people, how did you get into becoming an orthopedic surgeon? Like, what inspired you to get into that?
Well, I had a liking for science, but I also like to work on cars at the same time.
Okay.
Right. And then I like sports. So orthopedics was sort of a way to kind of combine all the three. As you know, you've been through some surgeries yourself.
Yeah.
Orthopedic surgeons sometimes joke and say that we're just glorified carpenters. You know, we use hammers and nails and drills on humans. So it was that ability to use my hands with healthy patients, and still take advantage of the science, just kind of attracted me to that. The other thing is that, choosing medicine versus business, I actually thought it was a safer bet in terms of just longevity and your future and predictability in terms of income. Okay. In medicine at that time, you go through 4 years of medical school, you go through 5 to 6 years of residency and fellowship, and you come out and you're basically guaranteed you're going to get a 6-figure income for the rest of your life, right? So that's a safe bet from a financial standpoint, right?
Yeah.
Whereas a lot of businessmen, some of whom can do very good in some years and can do very bad in others. So medicine sort of protected you from that kind of scenario. So it was kind of, the best of both worlds for me. It was what I wanted to do. And then it made sense from a financial standpoint in the future.
Okay. Okay. Well, I got here in my notes that I see you used the first in the world to do the Kennedy hybrid plasma scalpel device, if I'm saying that correctly.
You've been doing a little research. I've known you all your life.
I did my research, brother.
We're not going to talk about you, although I don't know if anybody's talking about the first time you went out in the court and played basketball, did they? That's a good story. We'll let your dad tell that one.
Yeah. Just kind of walk me through kind of what gave you, the idea, inspiration to kind of use that, being the first in the world. I mean, you're a pioneer for that,
Well, a lot of things in life are about, being in the right place at the right time.
Mm-hmm.
So I was actually in the right place at the right time when another brother from Philadelphia, his name is Jerome Kennedy, built a device called a hybrid plasma scalpel. So that's a device that when we're in surgery can stop bleeding better than the devices that we currently used.
Okay.
And so I was introduced to him, and he showed me his invention, and we decided to use it, and it was just amazing. So we just continued to go from there. But it's a pretty truly amazing device, and actually there's other advantages to it that go into the cancer realm. But in terms of orthopedic surgery, it's basically decreasing the blood loss. With instruments like that nowadays, joint replacements are outpatient, meaning you get surgery and then you go home within the next 4 hours.
Yeah.
That wasn't the way when I first started my practice before I got all these gray hairs over here. Patients would stay in the hospital for a little while. So I was just fortunate to be involved in that, and it's continuing to evolve, and it's just been a good experience.
Yeah, that was impressive when I read that. I was like, wow, oh man, Dr. Goat, man, he the GOAT.
Nah, man, I'm just Craig to you.
So what adversity did you face in life that kind of helped shape who you are today?
So that's a good question. Sometimes I look in the mirror and wonder how I got to where I got, because I was not supposed to be here, right? I think, as you can relate, that sports played a big role in the ability to overcome all life's obstacles. And so, as you know, I was a swimmer. As you know, there was a movie in 2007 called Pride about a Philadelphia swim team, which is still in existence. And that really kind of helped, with a whole lot of other things, shape the do not give up mentality, the do the work behind the scenes that nobody has to see so that you can achieve your goals. Mm-hmm. And that's kind of, so, I was an average student in high school. And I was a slightly above average student in undergrad. And it was hard for me to get into medical school, but through perseverance, through just, staying up all night and studying the stuff that people don't see, all they see is the end result. You got an A on test, right? Some people get A's on tests and they don't have to do much. They have God-given talents. Just like, as you know, some people on the football field they got some God-given talent, right? They don't have to work too hard to get it, right? And then others have to work really hard. But on game day, none of that makes a difference. All they see is the final result. So, it's the hard work after hours, constant. And I'm also a person that, I don't take no for an answer. Yeah. If I want something, I'm going to get it. That's the only way I look at it. And so that's kind of the way that I kind of got through things. So I got into Georgetown, not a bad medical school. Took a little work, but I got in. Had to work really hard. I got into orthopedic surgery residency, which is, in order to do that, you're supposed to be at the top of your medical school class. Now, I'm not going to sit here and say that was the top of my medical school class at Georgetown, but somehow, some way, I was able to get into a very competitive residency. Okay. And then the rest is sort of history. But, I would say that, obviously my parents, then the athletic part really helped me put everything together. I mean, there are times when you sit down and you're ready to just give up and cry. Like, I can't do this crap no more. I don't, and then one of the things that I always tell young folks is that don't be fooled by the person sitting next to you in class that gets A's and doesn't really have to work that hard for it, right? So, we used to have, after lecture at Georgetown, half of the class would go directly to the gym and work out all day and then go to the bar and then study for an hour later that night. And they always want to invite you. And it's like, you have to realize, okay, are you one of those guys that can do that? Or do you have to take your butt to the library to stay there until 12 o'clock at night? Well, I was the guy that had to go to the library and stay there just to get the same result. But some people were fooled into, okay, well, I'm gonna go hang out and have a little bit of fun and do whatever. And they ended up failing. So you have to know what it is that you have to do to achieve your endpoint.
Mm-hmm. Everybody's story is different. Everybody doesn't work the same.
Correct. But a lot of failures come because people don't realize that they are different. And you have to some people have to work harder.
Yeah, exactly true with that. So last question before we end, is there any, upcoming projects that you have, or is it getting that time where you just kind of?
I want to learn how to play golf real good. I already know how to play golf.
So here goes my question. Between me and my dad, or you and my dad, who's the best golfer right now?
Of course, me, man. Of course. See, your dad should be here right now. Let me tell you a little story about your dad. So your dad, when I met your dad, I first learned how to play golf.
Okay.
Right? And I had these hand-me-down clubs. They were wooden clubs. Mm-hmm. He calls them persimmon wood clubs. And he tells this story to the day, right? And that was okay. That was fine, but he played with me. We played, me and your dad had a lot of fun. Mm-hmm. Then I bought some real clubs and I started to learn how to play. And then, all of a sudden, he wasn't laughing no more. It's like, oh, wait a minute. I got a little game. Yeah. And that's when the rule book comes out. Before I would get a pass on the rules, like, oh, that's out of bounds. Oh, don't worry about it. Then when that came, so, but yeah, we had a lot of fun. But playing some golf, relaxing, not working so hard at this point, my son CJ, he's the last one out the house. My daughter's already out the house. So I'm just trying to relax and have some fun.
Yeah, that's all right. Yeah, you deserve it, brother. You deserve it.
Well, thank you.
I appreciate you again for being on. Listen, everybody, y'all go watch. Please share with your family. Hey, if you got your pops got a bad hip, you know what I'm saying? Doc gonna get you right. Mom Duke's got a bad knee, he's gonna get you right. Y'all, thank y'all for watching. Peace.
Peace.